And we want to go now to the president and CEO of the American Hospital Association for the latest on how hospitals are battling the pandemic. Richard Pollack joins us from downtown Washington this morning. Good morning to you.
Good morning, and let me just say at the outset, I just want to recognize the unbelievable work that's going on in our hospitals by the doctors, nurses, and other healthcare workers. Their dedication and their efforts are ones that we should all very much appreciate.
And I think everyone in this country would agree with you on that point, sir. I want to ask you, though, about what we need to know and what Congress should be focused on getting to those medical workers.
Yeah.
There's about $110 billion promised in this emergency legislation. What does that get the doctors and the hospitals around the country? Is it enough to meet the need?
Yeah, it's a start, and it's a very good start. The American Medical Association, the American Nurses Association, and us, the Hospital Association, all said that we needed a minimum of $100 billion. And we're hopeful that that package will deliver us the assistance that's needed, the tools and resources that are needed so that we can continue to respond to this crisis. This is an unprecedented situation in which we're entering uncharted waters. The congressional leadership on the Senate side, in particular Senator McConnell and Senator Schumer, are very attentive to this matter. We're hoping to see legislation that provides us with assistance when it comes to increasing capacity, when it comes to paying for overtime, and very importantly, when it comes to helping us with cash flow to sustain our operations. We could see hospitals close in this situation as well because they just don't have the resources.
The White House and the American Academy of Surgeons has publicly called on Americans and hospitals to reschedule elective surgeries because they don't want to overwhelm hospitals and they want to save equipment for those worst case scenarios. Do you now support that? Because I know you weren't supportive of that call for a while.
No, that's not quite right. We support guidelines that were put out by the federal government around the notion of elective surgery. And we have found that in most cases across the country, that is the case. Sometimes there's a little confusion between what's considered elective surgery. There are things that might be elective that are in fact life-saving, like replacing a heart valve. But there's no question that we have stopped doing that in a lot of areas.
On what you're saying is too nebulous. Do you think there need to be specific guidelines set out saying hospitals stop these kind of elective surgeries, plastic surgery, for example, knee replacement? Are those kind of specifics? Well, state and districts is what you have said should be able to make those calls. Do you want the federal government to provide more clarity on that?
Federal government has already done it. The Centers for Medicare and Medicaid Services has put out guidelines. We support those guidelines.
Okay. So how do hospitals then determine who can get needed medical supplies, things like ventilators? Is there a process? Is there a guideline in this, or is it luck of the draw?
In terms of ventilators, we're going to need more. There is a supply. Many people have them, but there's a gap, and we're going to need more. But the most immediate thing we need is personal protective equipment. The masks, the gowns, the goggles, that type of equipment to protect our healthcare heroes that are on the front lines. That is what is most essential now. If we don't protect our healthcare workers, the system will completely collapse. That's what's necessary. And that's why, in fact, we need to see the Defense Production Act employed in an aggressive manner. It's great that people are stepping up, but we need to be more aggressive in getting those supplies to the front lines.
Right.
They may be flowing, but we need more.
Right. No, and that is why I asked Dr. Fauci about that. Thank you very much, Mr. Pollack. We will be right back.